What is happening in the city, and is there concern that the rise in the cases that we're seeing in COVID could impact city services? We are joined, as we are on most Wednesdays, by San Antonio Mayor Ron Nirenberg, joins us live from his office. Mr. Mayor, when we see a number like more than 7,000 cases that we saw just today, do we need to put that in some sort of context when we're talking about just how contagious the Omicron variant is?
I think context is always extremely important, and the Omicron variant is the most highly contagious variant that we've seen throughout this pandemic. That much is clear. We are cautiously hopeful that the data will bear out that the cases are perhaps a little less severe. But the big message for us to continue to drive home is the fact that you can avoid serious illness and hospitalization by making sure that you're vaccinated, that you're boosted, that you're practicing the safe behaviors like masking up where appropriate and proper sanitation. That remains true. But the Omicron variant is very highly contagious. That's why you've seen the case numbers skyrocket. You've also seen the positivity rate skyrocket. And that's true across the country, and even in Texas, where in Dallas County, for instance, a couple of weeks ago recorded a 48% positivity rate. So we're seeing things that we had not seen before in the earlier phases of this pandemic.
You know, throughout the pandemic, the overall message has been that typically older people, adults, they tend to get the more serious illness. And when it comes to kids, the youngest people who can get vaccinated, 5 and up, we have a pretty low vaccination rate in our community. So how big of a concern is that for you and any of the other health experts that you're talking to?
Well, the judge and I convened the superintendents today to talk about that and the importance for us to get the message to families that our 5 to 11-year-old population, which was the last to become eligible with the vaccinations, still has a lot of room to improve. And we know those students are back in school. And so to protect them, we need to make sure that they're getting vaccinated. So if you are a parent of a child who's between 5 and 11, you are eligible for the vaccine, and you should go get it to protect them in the school setting to make sure that, again, they're not at further risk for severe infection. But yes, the other trends that we saw, the other data points that we saw earlier in the pandemic are still bearing out. This virus still attacks underlying conditions. So, and also folks who are older, who are more immune compromised, perhaps, are at higher risk for severe infection. But again, we need to get folks vaccinated, particularly those kids who just became vaccinated a few months ago. And we've got a lot of room to improve there.
I know when we talked last week, you had some concern about how such a highly contagious variant like Omicron could affect police, fire, even basic city services, city departments. Are you seeing that play out? Are you still concerned about that?
I am concerned about that, just as we are in the hospitals and maintaining strength of staff there. And the challenges of increasing patient loads and also nurses and healthcare professionals themselves coming up positive and getting sick. We've got to make sure that we have essential services taken care of in the city and throughout our public sector. I will tell you that the Omicron variant has also hit city staff and emergency personnel. And so we have seen staff ranks suffer. But it has not affected the delivery of city services, thankfully, not yet. We've seen a little bit of a drop in the number of positive cases this week compared to last, but we are very close in fact, we are at the highest numbers we've seen in terms of infections among employees, and we've got to watch that very carefully to make sure that it doesn't impact city services. I will also say that we're making preparations in the event that we do have to shift some of the load, rebalance some of the city services. But thankfully, we have not had to do that yet. We are preparing for that event, but we're trying to prevent it from happening.
We want to switch gears here to the vote expected tomorrow on the CPS Energy rate increase. The City Council taking up that issue tomorrow during council meetings. Are you expecting that to pass? Will that be approved? And if so, what's your message to everyone who will then be paying that rate increase?
Yes. Well, first of all, I will say, like you, I am a CPS ratepayer. We are all CPS ratepayers. We are also all owners of the utility. And for us to get the service that we expect from that utility as a public utility, we've got to make sure that we're providing the resources. We have asked CPS to whittle down their rate adjustment request to the very essentials needed to make sure that we are addressing weatherizations, resilience, making sure that we're keeping up with the infrastructure maintenance. And they have done that. And that's why they've reduced the request to below 4%. So I do expect it to pass because I think everyone, no one wants to adjust the rates ever. We haven't done that in 8 years. But we also recognize the reality that we have to provide our public utility the resources necessary to deliver the services that we require.
Yeah, it's interesting because you bring up the fact it's now below 4%. At one point, there was talk of maybe a 10% increase on CPS Energy bills. So just a little more context to begin and end this conversation with Mayor Ron Nirenberg. As always, appreciate your time.
Thanks so much, y'all. Stay safe.
You too. We'll be right back.